Hello, my dear friends. Today we're going to have another personal topic of Dr. Jackaman. And this is an advice not only for personal, for myself, for yourself, but it's an advice for everybody in life. Why? Because I think this applies to everything, to every job, to every organization that major organizations like Apple, Google, I'm sure Tesla, they have this amazing amount of amenities for the staff. And in some of our small offices, we don't count with that. This is a dental office. However, when I start practicing, I always wanted my staff to get in the morning and have some small stretching exercises, breathing exercises, and yoga stretch. Sometimes at lunch, we used to go walking. And I encourage the staff, even using our time, that in the morning when they come, they can do some stretch, breathing, and think positive about the day that is about to start. And why I'm saying that, because the wellness at work, it's extremely important. We're gonna talk in another episode on how do we treat the wellness and the health of our patients, and how do we prepare them not only from the dental point of view, but also from a spiritual point of view, from a personal point of view. It's not about any religion here, it's about the patient that walk in to begin is smell aromatherapy that I just learned today by one of my girls that she doesn't like my aromatherapy, but it has chamomile, lavender, patchouli, palmarosa. It has a delicious amount of oils to relax the patient. So when you walk in the office, it doesn't smell like a dental material. That we use something like clay. You know, the majority of the dental materials have clay or cements, and Dr. Vijay do prosthodontists here. So the smell is dental, right? But when they walk in this office, it's always the smell like a wonderful aromatherapy. But the funny thing, today Arlene, one of my girls, doesn't like that. I will tell you in later episodes what happened with that, if she ended up liking it, because I'm gonna find out, because I get very personal, not personal, but I get close to the staff. I want them to be happy, and I want them to say, oh my God, I'm gonna work with this crazy doctor, because I'm very strict, when I'm inside with my patient. But before, we're gonna show in another episode what happened behind the scenes, and another episode that is gonna be, the producer and I were talking about why not expose one life on the day of Fanny Jackaman, which is, it's crazy. My life is crazy, and I think everybody's life in dentistry have this craziness when we're working in dentistry. Working in dentistry is extremely stressful. So to have wellness in your office, you need to practice wellness for yourself. So in the morning, usually I try to do my meditation, do some stretching for my back to maintain, the health, the muscles. And after I get out, I come into the office, I already talk to the staff a day before about our patients of the next day. And in the morning, we review while I'm coming from the house, which is an hour driving from the house. So what do we do? What is the best advice I'm gonna give you? Number one, for all the young generations, I know they do that. Try to do some kind of meditation. If you're religious, do your prayers. If you go like Buddha, they do meditations, do your meditations, sounds, music, whatever is gonna help you, because it's very proof that there is music that can heal you, and there is music that can help you to relax your brain. So why is important that? Because when they are in the same page, like they say, they can be coordinated. My dear staff, Amanda, helped me together, we put together this topic where what is the first advice I'm gonna give you, the first tip? Organization. Be sure everybody knows. I tell them here, and applies for everybody in their jobs. You know perfect name of the patient, how do you pronounce it, what are you going to do when the patient walks in the door, if this patient is usually late, what are we going to do with the patient if we have an emergency, how are we going to accommodate that emergency. For me, the key in this office, I don't schedule more than 4 patients. Depending on the amount of time the patient required, that's what we do, and that's the amount of hours we plan for that day. Whether it's gonna be the 8 hours in a day, more or a little less, we plan our job accommodating and personalizing our patients to their needs. We accommodate our schedule to them, and we work with them. So that's why I manage anxieties and I manage pain. And when we are organized, which is the first step, remember, the first step, organization. Everything has to be in place in the right position. So when the doctor asks you for anything, you don't have to leave the room and get your instruments as an assistant, and the doctor and the patient, in my case, has the mouth open. The assistant is not gonna be shaking to know, oh my God, what is this? What drawer I need to open? The rules of infection control in this office are exaggeratedly strict. They have, of course, we change gloves constantly, 24/7, every single time that we get a sense of contamination or we're gonna leave the room, we come back. But not only that, if they have to open a room, they have a special instrument that are gonna open a drawer and take some instrument. Now, why did I tell you this? Because this organization is gonna relax the patient. The patients and the staff works happier. So this advice for everybody that maybe can take a little tip about this. And what is the second one? We have to be coordinated between us. So the minute that I stand up, Amanda or Arlene, they know where I'm gonna go, what room I'm gonna do, or maybe Arlene is gonna say, well, you need to go to room 3, and we all know what patient is in room 3, we all know what is the procedure, we all know what is gonna happen. If the patient came crying, then Arlene comes and tells me, we have a patient, it's an emergency, is crying because he fractured the tooth, and now has a huge inflammation on the mouth and is going inside. These type of infections, by the way, and I want my producer to take a note of this, or Amanda, we're gonna talk about how the infections can affect your body, and you can end up dead of a septic shock in the hospital if you have a dental infection and you don't take care of it right away. And this infection get in acute moment, and it goes to certain spaces of the brain. The patient gets septic shock, and by the time they get to the hospital, unfortunately, they die. Not many people know this, but it's important to know. Now, that is another topic, but the third step is communication. Now, what happened? Let's say today I just heard, well, somebody doesn't like this. I immediately go and talk to that person, what happened, why you didn't like, so the staff can be more relaxed knowing that with me, they have open communication. And that helps completely, enormously. Then we do meetings probably every 3 months, every 6 months, and sometimes we don't have the time, we do it every year. But we, every day, constantly we're meeting and fixing and making clear there is no misunderstanding between us and with the patient, and that is why we maintain the practice short. So communication is one of the most important, extremely important parts of a wellness in your life and in your practice. If your communication with your staff is broken, it's time to, each one has to separate. And the same with your patient. When your patient doesn't understand you, when your patient doesn't trust you, it's time that you find another dentist. And the same with personal life, friends, partners, husbands, wife. And if the staff is organized and is coordinated, the patient is gonna feel. So we prevent the patient. I talk to the patient, I will ask my staff certain instruments, and this is the way I direct to my assistant, suction, water, this, because it can mean some patients may think that we having a fight or we don't communicate well. But I talk to my staff, and we know that once the patient has the mouth open, we work like if we were in a surgical room. Why? Because as you see here, the vascular system of the tooth has an amazing amount of arteries, vessel, and a vein, and the nerve, and they are connected to the trigeminal nerve number 5 of the central system of one of our nerves. Now, and that's the 5th nerve. So that can create an environment that once you are in the mouth with the open tooth in contact with the canals that go to your body, everything we have here is like a surgical room operation. So that's the way we communicate. If the patient is sedated, they don't know. But if they are awake, they will know. So if we keep all of this together, what are we gonna get? The biggest professionalism that you can get. So we encourage the staff, if you have a personal problem, if you have an ache, your body ache, your head ache, you can excuse for the day and take a day sick, or we talk between each other and they said, listen, so-and-so has a headache, let's try to all of us get together and help each other. So if you have a fight, or I work here with Dr. Bijak and we have a disagreement, I have to be all the time expressing in a nice way to my patients. So I am very lucky I can extremely separate any personal situation. If we have pain, the patient is not here to see our pain. The patient is here to get cured, to be treated as my queens and kings. And I want everybody to be happy, especially here we have a group of girls, but we have an amazing team. But it's been a lot of work. We always have to be thinking positive and express to the staff, think positive, don't be negative. And if we see any shocking, because it's a gossip between, we always have to stop. With communication, good understanding, that organization, coordinating the office, have the professionalism, and having a good communication is gonna have the biggest success on the patient's treatment. And in your case, it's gonna have the biggest success in your life. I hope you like this little episode. And very soon we're gonna present cases of patients, but hopefully the next episode, and in one of these episodes, you're gonna find how do we apply this to the wellness of the patient. What it means for me, wellness of our patients, not only of the body, not only of the mouth, but of the body when they are sitting here. Why is wellness of the patient? Because I go deeper in knowing that root canal was needed for a reason. And I try to avoid the patient having a root canal again. And as I offered to you, if you have any questions, just contact us on YouTube or Instagram. And I hope you like the episode. Leave any questions that you want, and I hope to see you soon. Take care.